Hi there, and welcome to Histo with Ale, where we break down the science of tissues one section at a time. And in this episode, we're going to talk about what is histotechnology. Histotechnology is the science of preparing tissue samples so they can be seen under a microscope. The surgeon takes out a piece of tissue from the patient called biopsy. It could be any type of tissue, liver, stomach, bone, you name it. Then that biopsy is sent to a histology lab, and that's where we come in. We histotechnologists are the people behind the scenes. We turn that raw piece of tissue into a stained slide that pathologists can look at it under the microscope and diagnose and identify what's wrong with the patient. It is a critical part of detecting diseases, especially cancer. To prepare that stained slide, there are several steps. First, as mentioned before, the tissue is taken out from the patient. Second, we preserve the tissue using a method called fixation. This will help the tissue to not break down. The third step is called processing, where we remove water from the tissue and add wax so the tissue can be cut. The fourth step is embedding. This is a process of placing the tissue into a block of wax. The wax is then allowed to cool and solidify, creating a firm support that allows the tissue to be sliced into thin sections for microscopic examination. The fifth step is called sectioning, where we cut thin slices of tissue with a machine called microtome. These slices can range from 2 to 10 microns, but generally the most common thickness is between 3 and 4 microns. Staining, which is the sixth step, it is the process of using dyes to highlight different parts of the tissue under the microscope. The most commonly used stain is hematoxylin and eosin, or H&E. Hematoxylin stains cell nuclei a deep purple, while eosin stains the cytoplasm and other components pink. This stain is universally used in pathology labs around the world as the first step in helping pathologists make diagnoses. And last but not least, the seventh step is that when the slide is ready, the pathologist can finally look at it under the microscope to make a diagnosis. That could mean finding cancer, inflammation, or other diseases. So in a way, histotechnologists help save lives by making diseases visible, which is really awesome. Whether you're a student just getting started or you are exploring career options in the lab world, histotechnology is a fascinating blend of science, detail, and purpose. If that sounds like something you would love to learn more about, like, subscribe, and stick around on this journey through the microscopic world.